Doctors, we are live. You can start the session.
Sir, you are muted, Ramakrishnan, sir.
Okay, sorry. Thank you, Sai. Good evening, friends. On behalf of Tamil Nadu Ophthalmic Association, I extend a warm welcome to this today's session on Publish and Prosper. Of course, I have to thank and welcome our beloved friend, senior scientist, clinician scientist, Dr. Biswas from Shankar Netralia, who was a well-known figure in the field of VATs all over the world for the past more than 3 decades. And he is one of the very pioneer in the field of VATs, and not only that, ocular infection, and his contribution to the ophthalmic sciences so much. And we are really happy to welcome Dr. Biswas, and he is going to give you a keynote address today. And of course, I have to invite our panelist and speaker, Dr. Sri and Sri Devi Niranjan, and of course, my dear friend, Dr. Suhas, and of course, our Ravi Kumar, and my dear President-elect, I should not forget Dr. Nirmal Frederick. And of course, I have to thank our young, energetic MC member Prasanna, and of course, my sincere thanks and congratulations to the organizers of this webinar, Dr. Jayantan and Atik, Scientific Committee Chairman and Editor TNOA Journal, for in a short period of time. They told just 3-4 days back only that we want to organize such a, and also Dr. Biswas is willing to give a talk in this. Then I told immediately yes. So within three days we have prepared everything, and of course definitely the seminar is it's really, of course, it's a science. It's every day is developing so much, and of course clinical ophthalmology is nothing but research and publications, because without that, we cannot prosper in our field. There are so much of things happening in the field of ophthalmology. Every patient is something is a treasure for us. So many things we can learn, but how to disseminate this knowledge to others, that's a very important thing. In that, I think this seminar is going to give some insight to the young ophthalmologists and also postgraduates. With these few words, I am very happy and congratulate all the participants in this webinar. Now I request our President-elect to Dr. Nirmal to say a few words. Then I will hand over the mic to Jayantan and Atik.
Thank you, President. So it's nice to be part of this wonderful webinar organized by the editorial team, the Chief Dr. Jayantan and ARC Chairman Atik Sheikh. And nice to see the wonderful faculty. And this team is quite familiar with us. Nice to see their progress from joint editors and now associate editors, and part of this editorial team doing a wonderful job. And also seeing the journal coming on time. Every time it's a wonderful thing for a state journal. So our journal has really progressed by leaps and bounds, not only with indexing and also the citation has grown. Nice to see a lot of original articles coming up and new information, particularly during the COVID time also, we saw a lot of articles being published. That's a wonderful thing for a state journal. I congratulate and compliment this young team for taking the initiative and coming up once again with this research methodologies and scientific writing workshops. This Publish and Prosper, part 1, and having esteemed panelists, and head of the departments, Dr. Suhas, Dr. Kanmani, Dr. Sridevi, and of course the Guruji for all of us, Dr. JB, who arguably has the large number of publication in India. I'm sure is one among the top 3 in terms of number of publication. For so many years, he's been the star batsman for our editorial team as well. Thank you, JB sir. I hope we have at least 1% of your wisdom to publish and prosper. And of course, the young brigade taking up Shruti, Madan, Prasanna, and Niranjan Karthik. So all the best. I'm sure with all your insight, there will be a lot of new articles coming up, original articles and original creative wisdom, so that our citations will increase and our indexing and factor will increase, so that TNOA journal will be one of the top journals in our country and the ophthalmic segment. So all the best for you. Thank you for asking me to be part of this. Thank you.
Dr. Arumali, Vice President.
Good evening. I'm sorry you can't see me on the. I'm driving. It's wonderful to. It's a wonderful program that's coming up. I'm sure it's going to benefit all the youngsters. And of course, TNOA journal is growing by leaps and bounds. It's credit to all the previous editors who've done a fantastic job, and to the editor that's doing a great job today. So let's hope for the TNOA journal to grow much stronger, as well as more of our PGs and as well as our own doctors publish more and more, so that the publication numbers go up and the strength of the journal also increases. Thank you, sir.
Thank you, Dr. Arumali. Yes, Atik and Jayantan will take over.
Good evening, everyone. I would like to thank President Ramakrishnan sir for this.
Jayantan, you are not audible, Jayantan.
Come closer to the mic, Jayantan.
Yes, sir.
You are not audible, yeah.
Am I audible now, sir?
Yeah, better now.
Thank you, sir. So, good evening, everyone. I would like to place my regards to our president who has accepted this webinar, and thanks to each and every faculty who's been a part of it, and thanks to my editorial team. Because of the support, we were able to do much better. So, we are planning this webinar in 2 parts. The first one is Publish and Prosper Part 1 and Part 2. The first part will basically be focusing on the basics of research. When it comes to research and publication, most of the time we always have a hurdle that what to do, how to write, and it is always a hurdle for us. So just to overcome the hurdle, to have a basic knowledge of a scientific writing, we thought we'll plan it in the simple way. So the next part will have all the difficult parts, like the types of studies, biostatistics, everything will be there in the part 2. So to start with, I would like to thank the entire MC team. This is our advisory board, and we are pleased to introduce our associate and joint editors. And this is the host team of the section editors, who are always strict and also friendly for the peer review. Right. So we have the panelists, Dr. Suhas Prabhakar sir, who is a HOD of Sri Ramachandra Medical College, Chennai. Dr. K. Kanmani sir, Professor and HOD of Ophthalmology in ACS Medical College, Chennai. Dr. V. Sridevi, Professor and Head of Department of Ophthalmology, Government Kadalur Medical College, Chidambaram. Welcome, sir. Welcome, ma'am. So, as I said, the scariest moment is always just before you start writing. After that, things can only get better. So, our main aim is for the primary physicians and the postgraduate. It is mainly to encourage them to start writing. So, the first topic will be done by Professor Jyotirmay Biswas sir, who is the Director of Uveitis and Ocular Pathology Department in Shankar Naik, Chennai. He has got more than 494 publications in the peer-reviewed journal. He has authored more than 40 chapters in books of ophthalmology, has given 260 lectures in international and national conferences. He has received more than 26 awards. He will be giving the keynote address on why you should publish. A $1 million question, which will be answered by the right person. Next will be by Dr. Shruti Nisha. She did her undergraduation in King of Medical College. post-graduation in Aravindi Hospital, fellowship in pediatric and ophthalmology and strabismus in Shankar Nethralaya. Currently, she is the executive director and HOD of pediatric and strabismus in MNI Hospital, Chennai. She'll be talking on starting with the case reports. The simple thing to start with, when you have a patient, when you have an interesting finding, the best thing is to start with a case report. So she'll be dealing with how to write a case report. Next will be Dr. Madana Gopalan, who did his UG in Coimbatore Medical College, PG in RIO, Chennai. Fellowship, Victoria Fellowship in Shankar Nethralaya. He's a member of Royal College of Surgeons of Edinburgh, Fellow of ICO. He is currently the Managing Committee member of TNOA and the Associate Editor of JOSR. He'll be talking to us on writing and original article. The nitty-gritties of writing and original article will be done with Dr. Madan. Next will be Dr. Prasanna Venkatesh. He did his MS of Ophthalmology, Glaucoma Fellowship, and he has got published 4 chapters and 120 manuscripts, and that too in a very short duration of time. He is an editorial member of IJO and associate editor of TJO-SR. He is currently the head of research in Mahatma Hospital, Trichy. He'll be dealing with how are we going to do a literature search in a proper way, and how are we going to handle the reference management system. The last talk will be by Dr. Niranjan Karthik, who's done his MS in ophthalmology in RIO. He's done his fellowship in doing his fellowship in comprehensive ophthalmology in MSI Hospital, Chennai. He'll be talking on. So when you know what to write and when you have the article to write, you need to know how to submit. Most of us has gone online. So how to upload, what are the tips to upload a manuscript is what he's going to deal with. So with this introduction, I'd like to invite our first speaker, Dr. Viswasa, for his talk.
Good evening. At the outset, I'd like to thank Dr. Ramakrishnan, my very good friend, a very old friend, to see him, and it's a real pleasure. Dr. Ramakrishnan and Dr. Nirmal Fedri and Dr. Jananthan and Atik Madana Gopal. It's a really great pleasure and privilege for me to talk, to share my humble experience with you in publishing. I started with a baby step like all of us does, and just what I done. I thought that when this invitation came, Dr. Atik called me. I told what should I tell? I thought that I could tell about my journey only. I don't know want to talk theoretical things about it. So I'll just share you my journey, how I published and my humble journey. Yes. So let me share my slides. Am I visible? Can you see my slide?
Yes, sir.
Okay. Yeah, I'm audible also.
Yes, very much.
So again, I'd like to thank the organizer of the TNOA, the editorial board, and the TNOA ASC for giving me this opportunity. I will be touching on why should we publish? Why should you publish? What makes you feel that publishing is a important job, or there is something in publishing? I believe a scientific work, no matter how spectacular the findings are, is not complete until it is published. I know many of us in Tamil Nadu ophthalmology doing great work, but I am a little unsatisfied that they are not publishing as much as the others. So they should publish. The scientists must not only do research, but also must write up research works to communicate with others. So what is required in scientific publication? First and foremost is enthusiasm. Second is persistence. Third is strong commitment. And fourth is the passion. These are the 4 things which is required for writing up an article or a review article or a publication. What is in it for you? It's aged in history, persists forever. 8 minutes presentation will forget, but publication will remain forever. Publication is the gold standard. You can learn from the literature review before writing the article or journal or the review article.
learning from the review process. And what it gets is the knowledge gets crystallized. Once you start writing, your knowledge is much more get condensed and you get enriched. How I wrote, started writing, I just thought that I'll share with you. I started with baby steps. I first wrote in the house journal, Netralaya Insight. Dr. Badrinath used to bring out a journal from the Shankar Netralaya with our in-house articles. I used to contribute that articles. And believe me, it was tougher. Dr. Chandran Abram was the editor. It was tougher than American Journal of Ophthalmology, I feel. Then I started in Tamil Nadu Ophthalmic Journal. I used to send articles to Dr. Namparaman Swami and get elated when it gets accepted. I still running the art of scientific writing is okay that I have published about 511 PubMed Index publications. This is the article which I started in the Netralaya Insight, then followed by the Tamil Nadu Ophthalmic Journal. And then after writing few articles, I thought that there should be some suggestions or guidelines for writing. I thought that I'll share with you. So I wrote a practical suggestion in writing a research paper in Indian Journal of Ophthalmology in 1998. And subsequently, I wrote, publish or perish the art of scientific writing. I thought that these two articles, you can go through it, you might get some important information about publications. Publish or perish. I said publish or flourish. This is my one of the latest publications, the clinical profile, multimodal imaging and treatment response in macular serpiginous choroiditis. I used to see that serpiginous choroiditis sometimes involving the macula only, and I thought that I will compile that together. And for the several years, I used to keep the numbers in my register, and I could compile the together all the informations and wrote that multimodal imaging in serpiginous choroiditis, macular serpiginous choroiditis. So it's not rosy always. It's that 500 articles. I might have sent many articles, and this list shows that out of the 64 articles, 34 of my articles got rejected by Indian Journal of Ophthalmology alone. But remember that I tried in 64 times and successful in 27 times, and 34 times I was unsuccessful. So believe me, I believe in this quotation by T.H. Huxley, the known is finite, the unknown is infinite. Intellectually, we stand on an islet in the midst of ocean of inexplicability. Our business in every generation is to reclaim a little more land. It's not adding to your name or glory, it's just to have your bit to unravel the mystery of ophthalmology. So my journey and research and publication, my journey and way forwards, how I grew up, that I wanted to share with you. This is my humble experience. It was 1985. Many of you are not born. I just joined as a consultant, finishing my vitreoretinal fellowship. I was given a research project by Dr. Badrinath, ocular morbidity in active systemic tuberculosis. So what I did, the questions I asked with that time, what is the ocular morbidity in active systemic tuberculosis? What are the various types of ocular tuberculosis? Is Eales disease, which is thought to be tuberculosis etiology, is due to active systemic tuberculosis? These are the three simple questions we asked. And what I did, I went for 1 year to a tuberculosis research center in Madras. That time it was called Madras, and made a makeshift eye department and started seeing eye clinic and started seeing patients, doing slit lamp inject, ophthalmoscopy, visual acuity test. So I studied 1,005 patients in 1 year. And believe me, only 14 cases I found where it could be related to systemic tuberculosis. It was so frustrating, and I couldn't believe that. I thought that I will get many cases. But most common was heel focal choroiditis, And what we are looking for, Eels disease, no case of Eels disease was seen. So one of the cases was the miliary tubercle of the choroid, and this patient, I took him in an auto from Chetpet Tuberculosis Research Center and brought it to the Shankarnetralaya and took a photograph. And this was a miliary tubercle of the choroid, which I found in active tuberculosis in a patient, in a young boy, a young girl. This was photo taken 36 years back. I did extensive manual search in the literature. That time no internet was there. I found my observation was correct. And what I found that there was a study by American Journal of Ophthalmology was published. They found in 1.4% of the patient of tuberculosis develop ocular lesions. So this was a very encouraging for me. And I published this article in International Ophthalmology, Ocular Morbidity in Patients with Active Systemic Tuberculosis. So then I started looking into the ocular TB in our pathology laboratory registry. I found only 5 cases where the TB bugs were seen. I thought that whether I could write up these 5 cases. I tried in the Netralaya Insight and it got published. And then I made it in that publication in the Retina Journal, Intraocular Tuberculosis, Clinical Pathological Study of 5 cases, which includes subretinal abscess 2 cases, granulomatous uveitis scleral perforation 1 case, exudative mass in the anterior chamber 1 case, choroidal mass with panuveitis 1 case. This is a simple idea. It's not earth-shaking research, just combining few cases with clinical pathological correlation. This is one of the cases. This young lady had a subretinal abscess, and we couldn't draw that. That time, Montag fundus photography was not there. I did the drawing in my hand and made the subretinal abscess photograph with the hemorrhages, spots. And when you looked in the microscope under the magnifications, various magnifications, higher magnification, we could see that multiple pink-colored acid fuzz bacilli. It was like a myriads of acid fuzz bacilli in the subretinal space causing the abscess. We published it. Then we looked into the Eels disease cases. That time is about, in the hospital, about 10 to 12 new Eels disease cases per day used to come. 1 in 135 ophthalmic cases in Shankarnetralaya was Eels disease. And the people used to think that this is due to the tuberculosis. But there's no distinct proof for the same. I asked the question, is MTB seen in the vitreous fluid? So we got the vitreous fluid epiretinal membrane from the patient of Eels disease who are undergoing vitreoretinal surgery for vitreous hemorrhage or tractional retinal detachment. We did smear, culture, and PCR. And to our surprise, I worked with Professor Madhavan, microbiology department. I was almost like a microbiology student. And what I did found that there is a 50% of the cases, 5 out of the 12 cases were positive for Mycobacterium tuberculosis DNA, and culture was negative for Mycobacterium tuberculosis in all cases. This was published in British Journal of Ophthalmology, and then subsequently we did the epiretinal membrane PCR detection of Mycobacterium tuberculosis DNA, and we could find out that 47% of the ERM in Eels had Mycobacterium tuberculosis DNA. This is the agarose gel electrophotogram showing that Mycobacterium tuberculosis DNA amplified products. So we concluded a cell-mediated immunological reaction triggered by sequestered Mycobacterium tuberculosis antigen causes Eels disease. So that was from there we were long back, long after we started continuing looking into the Eels disease cases, and I found to have an eyeball of a Eels disease patient which has become blind. And this eyeball, I looked in the histopathologic, immunohistochemical, and molecular biologic study of the enucleated specimen. 8 of us, we collaborated together and published this article where we could find out around the vascular channels, there is a lymphocytic infiltration was there. And this lymphocyte was CD8 positive T suppressor cells. And we could also prove that microbiologically, there's a molecular biologically that Mycobacterium tuberculosis DNA is present in the paraffin section of the tissues. This amply provided the pathogenesis and etiology of East disease, showing the Mycobacterium tuberculosis producing an immunologic reaction, T-cell mediated reaction producing that inflammation. So what I did is that bits of pieces of informations and my own work, I gone through 300 full text articles, analyzed the global data on East disease, wrote 18 pages, 18 photographs, 6 tables, worked for a year and wrote a major review. And that was the East disease and update in Survey of Ophthalmology, which is often quoted in the work. It was a hard work, but the hard work pays. So I didn't stop. I thought that let me look into that East disease cases in a larger series. So I studied 500 patients, charts, 898 eyes with the help of an observer, Dr. Risha Jitesh from Kerala. And we together worked long hours, and we found that the East disease patients have bilaterality in 81% cases. Active stage oral steroid gives a very good prognosis. Laser treatment in the proliferative stage, better prognosis, and recurrence 52% had less than 5 recurrences in 10 years period. This is the very important information which you could gather from the large data. What happens is that you can get a good paper from the big data if you put hard work and analysis that such data. I started looking at when AIDS came in India, I started looking at the ocular lesions in AIDS. Many of us were afraid to look into the AIDS patients those days. So I reported first 2 cases of AIDS in India, the ocular lesions in AIDS. I saw in a span of 3 days, 2 cases. I wrote in a 1 week time, and this was published in Indian Journal of Ophthalmology, first report of first 2 cases in 1995. Subsequently, many papers came, but as I did it very fast, and that could be published as a first article on ocular lesions in AIDS. I didn't stop there. We together worked for that 100 cases. When we completed, we published in the American Journal of Ophthalmology, and the millennium year it came in the, and we found that 40% of the patients those days had one or more ocular lesions. So not only that one, I keep continuing working on the AIDS patients, and with Sudarshan, Dr. Sudarshan, my colleague, with ocular lesions in 1,000 consecutive HIV positive patients in India, a long-term study, we did that one. And CV retinitis was found to be the most common cause of opportunistic infection. So what I want to give the message is keep working on your data and learn in the process and share the experience. So we used to see that a lot of TB lesions in AIDS patients. So my fellow Rajesh Babu and myself worked together. We went to the AIDS care center and used to see the ocular tuberculosis patients. I thought that this is a little uncommon. And when we looked in the literature, we found that there is not much of information. And we published in American Journal of Ophthalmology, first report from India, ocular tuberculosis in AIDS patients. And these are the various ocular manifestations, small tubercle to pan-ophthalmitis, subretinal abscess. So always look for a new finding in a disease, and that's quite important. Epidemiology, the uveitis, I had a humble beginning. I used to keep record of all new cases. You know, even in the busy OPD, I just wanted to put down the name, MRD number, etc. And in the repeat by my own hand. And still I have the register of 35 years old better record of the papers of uveitis cases. I compiled it and presented as a free paper and wrote up a pattern of uveitis in India. This was the first time that what is the pattern of uveitis in India was published in the Indian Journal of Ophthalmology. And with Dr. Devashish Das, 465 new uveitis cases was analyzed. I don't want to go into the details of it. What I did is that I keep following the data. And 23 years after, I wrote the changing pattern of uveitis in South India, comparison between the 2 decades. And I found the etiology was more found in the as the time goes by. And recently, 66% cases, we could find out the cause of the uveitis. Intermediate uveitis is the second most common cause of uveitis. Most common cause of post uveitis changed from toxoplasmosis to tuberculosis, and viral retinitis has increased from 0.76% to 6.8%. And then we had everybody of us look at the parasite, but I had a special interest in parasite. I don't want to show the video of that one. So several parasites which are seen, I took in the veterinary college department and looked into the pathology of the one and clinically correlated it. And this was published. And this first time we published intraocular Gnathostoma spinogerum, clinical pathological study of 2 cases with review of literature. I took the specimen to the botany department of Madras University to get the scanning electron microscope. So there was a dead parasite, never been scanning electron microscopy done before in India. And this was the first example. Seeing a parasite in the eye is a chance. Many of us have seen it, but you need to work it up fully and writing it up, and it needs effort. And if you put effort, I can bet that efforts never fail. And this was the documentation of the parasite, small tiny iris holes, 2 tracks of the parasite. I noted it down, I documented it, and did the scanning electron microscopy and histopathologic study. Ocular malaria, this is a clinical and histopathological study we did together. A patient, young boy, a young gentleman went to Kodaikanal and got falciparum malaria and died. Patient eyeball was donated to the Apollo Hospital, Chennai. And I got the eyeball as a donor eyeball. And when I saw the retinal hemorrhages, I tried to find out that what is the cause of the disease. And then I found that this patient had malaria. And I looked into the histopathologically malaria parasite and day after day, and I could find the malaria parasite in the choroidal blood vessels. And that was published in ophthalmology journal. So what I want to tell you that when you want something, all the universe, in fact, conspires in helping you to achieve it. Turning point in my academic career is fellowship in ophthalmic pathology in Doina Institute of University of Southern California under legendary Professor Dr. Narsingh Rao. And he showed me learn the art of writing. I even didn't know that grammar and English properly, but I started from him and the art of writing. And I wrote, coming back to India, I started writing on pathology, clinical pathological correlation in uveitis, and wrote about biopsy pathology of uveitis in various journals. And this is one of the articles with Dr. Radha Annamalai. I don't want to talk more about that one. I just wanted to give the message, but I want to tell at the same time, it's not a single person's work. My mentor, beloved chief, has helped me a lot. And in fact, is that if I am today, whatever I have publication is due to him, and this support and his support and encouragement. Dr. Narsingh Rao, my mentor from USA, and a lot of students, optometry students, fellows, colleagues have helped me. And this is my teammates. And you need to be a team man. You alone cannot do everything. And I never forget my photographer, who is no more, Mr. S.P. Govindarajan, who really stood by me and gave excellent photographs with which I could publish a lot. Last but not the least, my wife, which you tolerated my long hour in the hospital, coming late in the night. And in fact, is that my first international publication, primary non-familial evaluation, which I tell many of the times, I wrote 7 pages. Reviewer asked me to reduce it to 1 page. The one article, 1 page. I simply couldn't do it. And my wife cut it off and make it on 1 page. This was my first international publication. And this latest publication is SSOCTA in choroiditis. I feel that today you need to look for national and international collaborative research. The days of case reports is probably not there anymore. Analysis of big data, artificial intelligence, proteomics, metabolic biomarkers, new imaging techniques, next generation sequencing, targeted and local therapy. And this is my colleague, Dr. Rajiv Raman, published Artificial Intelligence and Deep Learning in Ophthalmology. I think we should explore this in our ophthalmology study. A new molecular marker like tumor marker in PVRL, primary vitreoretinal lymphoma, we studied that one with Dr. Krishna Kumar from our Shankar Netralaya. And last but not the least, new therapies in uveitis. We need to explore the new therapies in our ophthalmology treatment. We published in the biologics in uveitis, a new armamentarium in the management of uveitis. We also published JAK inhibitors in scleritis. JAK inhibitor is a new molecule which acts very targeted approach, and we can have a very good results in several recalcitrant inflammation. This is a photograph before treatment and after treatment. And I'm still working and I enjoy writing. My recent publications is that granulomatous with polyangiitis, a collaborative study, and laboratory investigations in infectious uveitis. Yesterday, day before yesterday, I got a parasite in the eye and Nasostoma spinigerum. I called that doctor and I'm after him to write it up together. I still enjoy the thrill of writing and like to share with you my experience. So I feel in conclusion, publication is more important than presentation. Index publications remains forever. You need to allocate your time for publications. Enthusiasm, dedication, and sacrifice is necessary. Routine way, I don't think that you can publish. Collaboration is the key to success. You need to give a little bit of time, effort, and sacrifice. And last but not the least, I want to come back to the quotation again, that even if you publish, it's a small thing you are doing. The known is finite, the unknown is infinite. Intellectually stand on an islet in the midst of ocean of inexplicability. Our business in every generation is to reclaim. What we are trying to do is to reclaim a little more land. Thank you very much for patient hearing. I'm really grateful to Tamil Nadu Ophthalmic Journal for giving me the opportunity. Thank you.
Thank you so much, sir. 511 PubMed indexed publications, and you have told us you are still learning. I'm sure most of your initial days were done before the pre-EMR era. What a journey you have had. An absolutely inspiring talk for anyone who wants to begin his career as publication. And it was like listening to Gajani story. You said you failed 34 times, your articles were rejected in IJO, and then you ended up with 64 publications in IJO. Right from taking your patient from Chetpat tuberculosis hospital in an auto to SN to take a photo, and then taking the patient's sample to botany department to have an electron microscopic view, despite the schedule that you have in SN, is truly amazing. Thank you so much, sir. It's truly an honor and privilege for all of us for this wonderful lecture. Thank you so much, sir. I request our panelist, Suhas sir, to say a few words, please.
Thank you, Atik. I think I was really awed by looking at the type of work JB sir has done over the years, and knowing him, he is such a sincere worker. And the important fact that he has told is, never leave anything to imagination. You work, go around it, pick it up, even if it is smallest finding that you see, it's a case report, scenario, whatever it is. You could probably see another case in a matter of time, or you can probably publish this. The more important thing that people look out for is what is new in what is already existing. So that becomes the most important point. And he has gone through a journey where I think he has been the first in many of the introductions. So I think there is something that we all have learned, and probably his articles are referenced for all future publications, which he has also mentioned. Thank you, sir. It has been wonderful listening to you. And I think the persistence, and that's the key word, persistence, and make sure that you should have a passion to publish a paper. And that should get inculcated into younger postgraduates who take up the profession. And I think this talk should have been heard by a lot more people. I don't know how many people are hearing this as an audience. I think thanks, Atik. I think this is a wonderful session. And to hear Dr. Biswas, his journey was really wonderful. And nothing more much to add as far as see the important points, 2-3 points that I would like to add is, whenever a paper is being published, it helps you clarify your own goals of research. It will also help you in reviewing and interpreting your own data. So the two things. And then force you to compare your work with others' peers when you go on, especially when you go online or in the net. So this also gives you to validate your own data, which will help you to work further, and also others to help them to improve on their research if this helps them in their whatever data that needs. So this is all, it not only individually helps you grow, but also helps others in the community also to professionally improve their scientific thinking. So this becomes very important. And as a teacher, I think this is, I would definitely encourage all my postgraduates to go through any presentation that is there, to jot it down and make sure that it is presented in the next the journal or in a conference as an article. Thank you, Atik. Thank you so much.
Thank you, sir. So we'll move on to the next speaker. Request Dr. Shruti to start your presentation on starting with the case report. Over to you, Shruti.
Thank you, Dr. Atik. Can you see my screen?
Yes, Shruti.
Okay, great. So once again, thank you for this wonderful opportunity to present here. And immediately following JB sir, I think I'm still trembling from the effect and the after effects of his talk. So he's a giant in the Indian publishing scenario, and following his talk, I think we really, you have a lot of goosebumps, and it's a little scary, to be very frank, because you see all the body of work and you think, can I ever fit into that kind of a, that kind of a portfolio? And then this is the topic that you should look, because this is exactly where to start. So we're all going to think, how can I be JB sir? And then we think like, how was JB sir? So we're going to think of a young JB sir who's going to start on his first case report. And that's how I would like to start this. So every researcher or every student who wants to start would always want to start with something simple, something easy to understand, and something that they can learn and grow in. A case report is the best kind of option for that. Now, the first notion that we have to do away with, and especially after looking at great publications and great researchers, is that I can't do this because I'm not good enough. And to start off with, it's the perfect time to say that we can do this, and it's always good to start at any point of time. Now, publish or perish was the earlier notion that was happening, but nowadays people talk about publish and prosper, which is the title of our thing, because prospering is something that is publishing and prospering are some two positive words that go together hand in hand in every researcher and every ophthalmologist's journey in career. So it's always important to challenge oneself. It's easy to do away with a clinical life, but it's important to prove ourselves in the research world, because like JB sir said, being a clinician is easy, but if you want your work to live on forever, you need to publish. So the simplest ways to start are a case report or a letter to the editor. So basically, a case report is the earliest stage of giving shape to your ideas and molding the case in such a way so as to make it into a presentable format. So so imagine you're a person or a postgraduate sitting inside an OPD and you see something interesting. You see an interesting case and you're like, wow, this is something that looks different. So it can be a nice outcome. It can be a diagnostic assessment that is new. It can be an intervention that's a little different, or it could be a new or a rare disease or a newer therapy. Whatever it is, you suddenly feel like this could be different or it could be publishable. So after you get that initial feeling, you need to go further and gather information. Now, this is the second important part that many of us forget to do, because once you see a case worthy of doing it, we kind of leave it off, but we should never. We should always pursue that interesting phenomenon and try and gather more information. And once you gather information about the patient, like the details, the photographs, the history, and so on and so forth, you go on and try and understand why this thing happened and how is it new. So now this is how a case report gathers from sitting in an OPD to going back to your room and sitting and thinking about the case. Now, case report is like storytelling in medicine. It is important to make it clear, short, and useful. You should not have long sentences and dragging sentences. It is a very powerful and instructional tool. It is not yet redundant as because there are more and more higher level of articles that come in, but nevertheless, it can be a very powerful tool. It is an attractive read as well. And the most interesting thing is that there are no analytics in this, so it's easier to publish. Now, it is very important to remember that a case report comes right at the bottom, like at the unfiltered information of the pyramid of research, and whereas the systematic reviews are right on top, but this is a good place for us to start. Now that you have an interesting case, it's important to knock the right door. Usually the mistake that researchers do is that they start writing the case report and then they look for the right publishing journal, but it should be the other way around. Once you have a good case that you want to publish, you should always look for the right journal first, look for an index journal, look for a peer-reviewed journal, look for a journal which has a good impact factor, look for the relevance and scope of that journal, which I'll be showing you, look at the acceptance rates and how long it takes for the journal to be accepted, and look for how good the publication process is. So this is how you work towards getting the right journal in your mind. Now, how does it work? So for example, let's take IGO. If you take this, if you go to the journal, about the journal, you look that they have good abstracting and indexing information. So you can see where all the journal is accepted and which are the web bases that you have the journal available. And of course, you have the impact factor that is also published. So you can easily see what is the impact factor. Now it is almost 2.9 at IGO. You can also see the ethics of the journal that the journal follows. So that's also available. And you can look at the scope of the journal. Now, the scope of the journal basically means what are the areas which the journal covers, or what are the articles that they're more likely to accept. So this is what the scope of the journal is. Now, it's important to read the author guidelines carefully. So this is available in the instructions to the author page. So you can, once you visit that, you can see that they have very specific word limits, and they have very specific headings that you have to follow. You have tables, figures, artwork that you need to have very strict specifications for, and you need to have reference, the type of reference management system and the reference publication that they look for. So once you have that, you have the format of a case report. So the format is that you have to go through a title, authorship, abstract, introduction, case report, and so on. So the title has to be very clear. Excuse me, just give me a moment. Just give me a moment.
There is no audio.
I'm sorry. Can you hear me now?
Yes, Shruti.
Okay, sorry.
Yeah. Now it's okay.
Yes, sir. So a case report usually starts with a good working title. The title has to be crisp and tell exactly what the article is about. The second is the authorship. You have to give the right weightage to the right authors. Abstract should be not more than 100 to 200 words. It can be concise, precise, and also talk about why this case is unique. And it's important to talk about the uniqueness of the case. Of course, followed it by the introduction. The introduction has to be comprehensive. It has to be very crisp as to why you chose the case and why the case was interesting in the first place. This has to be followed up with the actual case report. Now, when you talk about a case report, it has to be in chronological order and it has to be non-biased, which means that you should not have any of your opinions on that. It should be what is there, what was seen in the patient. So you have the presenting concern, the clinical findings, diagnostic assessments, what are the therapeutic interventions that was done, and what was the follow-up and the outcomes. And all of this should be in chronological order. It should be added up with adequate figures and tables. Next, we move on to the discussion. Now, when you have a discussion, I usually split it up into 3 parts. The first is, why is this case unique? That's important to show what is the unique feature of this case. The second part is, what does existing literature say? why does existing literature, how is this case different from existing literature? So these are the three ways. So why is this case unique? What is the existing literature? And how can you connect the existing literature to your case? So this is how you do the discussion. And finally, the conclusion has to be very crisp, and it can also have some recommendations or some form of teaching points that you have underlined or outlined from your entire case report. Now here, it's very important to have good patient confidentiality, have a good written consent form, and add your acknowledgements, and important to have crisp references, not more than 15. So think, then you check, and then you submit. So if you have any doubts in preparing the manuscript and to look for journal ethics, you have these kind of guidelines that are available in the International Committee of Medical Journal Editors. You can visit this website and you have these principles and guidelines that you can learn and take information from. You also can visit the Equitar network. Now, when you are a beginner, you have certain checklists that can help you start off on your case report journey. So these checklists are available for all forms of studies. Especially for case reports, you have the care guidelines. Now here you can see these care guidelines breaks up each aspect of your case report and asks you specific checklist questions. For example, the title. Does the diagnosis or intervention of the title followed by the words case report? Now it's important. It's a very simple checklist, but it's an important thing to have. Now look at discussion. You can see this broken up into 4 points for checklist. And each of these points, if you just tick them, your actual case report is actually done. So it's interesting to go through these care checklists and such checklists that help you analyze how your case report is done. It's important also to draw flowcharts wherever required to give a kind of idea into how the patient flow is and in such a format, and take really good quality pictures like this, which hide the patient's identity as well as have a good quality image. So when you have an idea for a case report, you plan the study, you make the outline of the document, you collect the relevant data and construct tables, and then you have your first basic manuscript. With that, you check instruction to the authors and the checklists, and you have your second presentable manuscript. Then you send them out to your co-authors, who then check them and send you back the third good manuscript, which you then do a final word check on word limit, reference managers, and then you submit it in the right journal. Now, of course, nowadays you have a lot of help available with these paraphrasing tools like Grammarly, Quillbot, and of course, I don't want to mention it. I think it's going to be illegal, but you also have open AI sources like ChatGPT, which help you gain access to information in a much faster way. So these are just examples which I wanted to show you. This is an example of an unusual or a rare disease. You can present an unusual presentation of a known disease. You can have new methods of diagnosis. You can have unexpected associations between diseases, and you can have newer modalities of treatment. Now, these are all interesting ways to present case reports. Now, when you submit, what are the kind of case reports that the editorial office is looking for? It's based on the Pearson's conceptual scheme. So they're looking for good documentation. They're looking for educational value, interpretation, objectivity, and uniqueness. So I'm going to skip the letter to the editor. So when you have a letter to the editor, it's a little controversial because some people like it, some people don't, but it's also an early way to start off on your research journey. So some of the people may be like, I have submitted, but I was rejected and I felt dejected that it was rejected, and I felt I don't want to do this again. But believe me, this is one article that got published recently, but it was rejected once, not once, not twice, but thrice. And the fourth time it got accepted. So there is always a will, there's always a way when there is goodwill. So keep pushing until you succeed. So, and always have good mentors and good people to look up to who are publishing well, so that you always keep inspired by looking at these people. So this is my last slide. It's important to start now, because the fear will not allow you to start. So start where you are, start with fear, start with pain, with doubt, with your hand shaking, with trembling, but don't stop. Start where you are, start with what you have, just start. Thank you so much.
Thank you, Shruti, for this wonderful talk. So when you see something new, gather information, think why this should be published, go back to your room, look where to write, and then think of how to write. That was a totally different concept or a different approach. Thanks for this wonderful talk, Shruti. I request Kanmani sir, our panelist, to have his views on this session, please.
Thank you. Thank you, Dr. Sheikh. Can you hear me?
Yes, sir.
Atik Sheikh.
Yes, sir.
Can you hear me, sir? Hello?
Yes, sir. We can hear you, sir.
Yes.
Yes, sir. Yes.
Sorry, sir. Actually, I have been attending a close relative's reception because it could not be avoided. I heard Madam's Sridhi Nishanti's speech. It was very wonderful talk. And she told publish or perish older days, now publish and prosper, now publish and pioneer, because the way she told everything, publish and placate the listening ears. So she has enumerated excellent ways of publishing a paper, and it has been a wonderful talk. I thank her wholeheartedly. She has really inspired all the youngsters, and youngsters should take a cue from this talk and start publishing. Nowadays, publishing is a very important, and it is almost a compulsory thing, whether you are in the government side or in the private side, for you to be known to the world. And not only that, for self-gain, but also to share the knowledge. Whatever you have learned should be shared to the entire humanity, and this publishing is one way of doing that. And as Biswa sir has already pointed out, finding is a chance, but working up it is an effort. So effort, collaboration, and the recent advances in technology, the harnessing the technological advances is also very important to have a very good publication. On the whole, it's a wonderful talk, and thank all the organizers, and my hats off to thank you so much.
Thank you, sir, for your wonderful inputs. So I request the next speaker, Dr. Madana Gopalan, to talk on writing an original article. Over to you, Madan.
I hope my slides are visible.
Yes, Madan.
Yes. Good evening, everyone. I thank Dr. Jayantan, Dr. Atik, Ramkrishnan sir, the entire TNOA for this opportunity. It's in fact a very big pleasure to be presenting in front of such an august audience, which includes one of my mentors, JB sir. So thank you all. And the topic given to me today is how to write an original article. So we've heard an inspiring talk from JB sir himself on how we went about publishing. And Shruti has highlighted the important points about how to start with the case reports. So now I'll be speaking about original article. How do you write an original
article? Kanmani sir, is it possible to mute yourself, please? Sai sir, can you help us? Manjula madam? Sorry, Madan, for the disturbance.
That's okay. That's okay. So at this point of time, let us presume that we have chosen our topic of research. We have thoroughly checked what has already been done in that particular topic, what's already out there in literature. So we need to be clear about what gaps we're trying to fill with our study. And we probably collected our data. Everything is done at this point. So now we're trying to put it down on paper. We're trying to write an original article, and that is what I'm going to say. So in writing an original article, we usually follow this IMRAD format. That is the introduction, methods, results, and discussion. This is more or less the standard. But when we try to write a manuscript, the authors usually follow a little different pattern. We usually start with the method section, because that is where you can actually start writing the method section even before the study is completed. Even as the project is underway, we can write the method section, because we do not need the results and data to write the section. We only need to write what is being done. So this can be written first. Next, when we have the final data and the Excel sheet, we can make our charts and diagrams. Then with that, we can write the results section. Now we know what our data is telling us, what our results are. So based on this, we can do the discussion. And to be very honest, only at this stage do we ourselves, the authors ourselves, know what our study is telling us. So at this point, it would be appropriate to write a small introduction. Finally, we can write the abstract. This is usually how we do it. Now, as mentioned, the method section has to give a clear overview of what was done and how it was done. Some mandatory information like Institute Ethics Committee clearance, Declaration of Helsinki, consent has to be there. If you're doing a clinical trial, what is the registry and what is the number of the trial? Importantly, where was it done, when was it done, and how long was the study done? What were the inclusion criteria used and how did you exclude patients from your study? Did you have adequate controls? And if you did have controls, you can probably present them in neat little flow charts so that somebody, looking at it, they can get a good idea of what you've done. And variables have to be measured in standard units. And the machines that we've used, the make of the machines also have to be mentioned so that somebody else can replicate the study. And it's good to mention the Equator guidelines, as Shruti was just mentioning. For an original article, you'll probably be going along with the consort or strobe guidelines. Then when it comes to stats, one needs to mention the methods and software used. Overall, I find it easy to use subheadings within the method section. I like to use 3 subheadings. First, I start with the participants, and then data collection, and finally statistics. So this is how the method section is written. Next, we move on to the interesting part. So once a study is completed, our data is available in an Excel sheet, and it's like this, something like this. So each cell is populated by, a lot of numbers and words and all this. This is the entire story that you have. So now it is up to us to make this particular story very interesting and, present it in a manuscript so that somebody reading it is also intrigued by what we have done, and he wants to know what the result is. So for that, we have to distill the essence of this particular Excel sheet and present it in neat little tables. So we probably have space for 4 or 5 tables in our article, so we'll have to use them judiciously. We can bring data into rows and columns like this. We need to remember that continuous data have to be presented separately and categorical data have to be presented separately. At the review stage, very important is that editors and reviewers will be interested in your tables. How well have you presented your data in the tables? Are they easy to understand? And can we understand the tables without, looking into text? So you do your tables contribute to the conclusions that you're going to derive. So one needs to remember this when making tables, and we can use a few diagrams also. Diagrams usually of 2 types. One is a schematic or a clinical photograph that's seen on the left, or statistical, like a diagram that represents statistical data like a box whisker plot on the right. Be it what it may, you need to make sure that your legend is very, very descriptive, and all the abbreviations are spelled out. So the figure and the legend should stand alone, and they should speak for themselves. Now, once we have the tables, we begin to write the results section. In this section, a few general rules would be try to give most of the data in tables. And once you've given it there, do not repeat what's mentioned in tables again in the text. So we can point out relationships and trends. Do not give any conclusions in the result section itself. And then if a sentence has to start with a number, it has to be spelled out. And then overall, we can try to give a general picture like demographic and baseline data first. Next, we can compare groups. If you have 2 groups, then compare the baseline data. Then compare the groups based on follow-up data. That would be a good way to do it. Thereafter, you can go into trend analysis, associations, and regressions. All these can be mentioned. And the result section would overall be probably 3 to 4 paragraphs long. After the result section, we come to the discussion part. This section gives us the most freedom, but again, we should not overdo it. We should discuss what our data directly proves, not what it could prove. Again, conclusions and interpretations should be supported by data. Very important. Do not digress and extrapolate conclusions based on data from your referenced articles, because our present study may not have the relevant data to derive those conclusions. So we can compare similar research. We can offer explanations if our results are different. More important, it is to anticipate what our readers want. Put yourself in the reader's shoes and see what they would be expecting and try to answer those questions. Using a reference manager would greatly help in this regard. I'm sure Prasanna will do justice. Else can improve upon your study when working on the same topic in future. A conclusion can be mentioned as the last paragraph. Some journals do allow for a separate section also. So now, again, as I mentioned, it's odd that we talk about introduction after writing the conclusion, but yeah, that's how it usually works. The intro section is like opening a conversation with somebody new. So you need to be very smart, you need to be very crisp, and you need to put yourself across in a very short way and in a very good way. So that's why it comes after you've almost finished writing your paper. So we'd like to state what is known in that topic, state what is unknown in that particular domain, and then finally build up to your research question. So this is how I would use it. It's, I mean, as I said, it's usually to gain attention. So keep it short, 2 to 3 paragraphs. Usually there are abbreviations here that you would use throughout the manuscript. They find first mention in the introduction section. So expand them first and give the abbreviation in brackets. Then coming to the abstract section, it can be free form or structured abstract. Your journal will require specifically, so you'll have to check that out. Again, expand abbreviations at first mention. Usually people have trouble with the word count when getting the abstracts right. So in that case, what I usually do is I just leave it alone for a couple of days and come back to it later. Probably then I'll be able to cut out a few words which I think are really superfluous. Then I need to frame proper keywords, because that is how people are going to search for your article. So I put myself in the another person's shoes. So what keywords would I be using if I'm working in this area and I want this article to pop up? So those would be my keywords, very important. Now, finally, the title and abstract are the calling cards for your article. These are the 2 areas that are going to be viewed most in any search, be it PubMed or any indexing software. This is going to be viewed most. So we have to keep it simple and specific. Avoid rhetorical questions in the title. Avoid giving conclusions. So I prefer writing a title at the start. Then I reassess and refine as my article takes shape until I feel that a particular a phrase or a sentence is catchy, short, but it should be detailed enough to convey what I have done. So that's how I fix the title. Now, to conclude, I'd like to reiterate these points. So it's important to respect the journals, editors, reviewers, and most importantly, the reader's time. Stick to word table chart limits. Do not repeat information. Use clear and simple language. Do not overreach. Be clear. Be very clear about the research question that you set out to answer in the first place, and give a clear, concise answer to that in the conclusion. Thank you for the opportunity.
Thank you so much, Martin, for a wonderful talk on how to write an original article. I request Dr. Sridevi, Madam, our panelist, to give her comments, please.
Thank you, sir, Atik sir, for giving me this opportunity. Can you hear me?
Yes.
Yeah.
It was a wonderful presentation of the how to write an original article, and I never knew there was a IMRAD to follow all this to write an original article. Today I just came to know. I will definitely implement for my postgraduates. And the how to really write the results and what is the difference between the discussion, conclusion, and interpretation was clearly mentioned in the talk. Hats off to you, sir. And the best part was how to give an exact title to your article. So that was the best thing that I could gather from here. Thank you, sir, for the thing given. It was a wonderful talk, and thank you, Atik sir, for the opportunity.
Thank you, Madam. Jayantan?
I think probably we can sum it up at the end. So it was nicely talked. The talk was actually going nicely as of what we thought. So the first key take home was that we need a data. That's what JB sir said. Have a data. And the wonderful thing which I felt with sir saying is writing down in the paper. So that was a very nice one. So whatever case you see, just write it down. Next, as been said by Dr. Shruti, go home, sit, think about the data. And finally, as Dr. Madan said, write it down, keep writing it, give a time frame, and then do it. So take from Dr. Madan's talk, as he said, for the discussion, you really need a good literature search and reference management. And that will be dealt with Dr. Prasanna now. Dr. Prasanna?
Yes, sir. Sir, is my screen visible, sir?
Yes, Prasanna, you can.
Yes.
You can see.
Yes, sir. Audible too now, sir. Okay. So literature research and reference management. So I'd like to thank the editors IJO and Sharmila ma'am, under whom I had most of my publications, followed by Jayantan sir, who has given me the opportunity to serve as the associate editor. And the following slides will be a more practical approach with some more videos on how you can manage your references and your literature. It's one of the methods that I felt will help the neophytes, and it's ultimately practice, practice, and practice. So literature review as well as the reference management is one of the most important steps of the protocols that we end up doing a case report or an original article, as the previous speakers were telling. So literature review is just one piece of research that builds on to the other. See, for example, blockchain is one particular technology which we are currently using it for AI. And this is one of my articles which we published for AI data management. So it was just one more step higher to what it was already there. Similarly, when the outbreak of TAS came in and the communication was being dealt in WhatsApp, we felt of creating a blockchain technology so that it is more decentralized and more safer. So these are some of my articles, as you can see, with the permissioned blockchain and the permissionless blockchain. It's all one step adding on to the other. And also you can see it is the use of ideas in the literature to justify the particular approach to a topic, selection of methods, and it is a more continuous process that you want to search in the literature. Meaning, this is one of my original articles, exploring the complaints on anti-glaucoma medication in literate patients. So why did we choose literate patients and why did we choose an urban tertiary eye care center? Is complaints was always attributed to people from rural areas or people visiting a setup which is semi-urban or rural, or people who are not economically viable. So this study again was never done in a setup where the patients were literate. So it also proved that this is a gray area which was never explored. So it adds one brick over the other. So before you start your research, choose the right question, do a systemic literature search. And for choosing the right question, you need to know what is the puzzle that is actually missing so that you don't reinvent the wheel rather than going for something new. And also consult your advisor or a superior, identify research gaps, check the feasibility, as Biswas sir and speakers before me were talking about their mentors. Mentorship is very, very important when it comes to publication. And literature search, check the appropriate question that you want to, check the references of those literature that has been published, and even refer books, refer conference proceedings, government reports, online databases, and so on. Even a crisis like COVID can serve as an idea for a publication where we started implementing a non-Mydriatic fundus camera for all the patients during the initial opening of the lockdown of around 1,539 patients. We evaluated the data and we also published it. Sometimes the idea may just be there in your OPD and it may be there in your timeline. You just need to go ahead and get the study done. Literature review, academic writing, demonstrating knowledge, and it is also a piece of understanding the academic literature of the specified topic placed in the context. That is very, very important. So you'll have to refer both published documents as well as unpublished documents. So in a nutshell, that is very, very important for you to refer both published and unpublished, and then you can divide it into information, idea, data, evidences, investigations. And also the second step is the effective evaluation of these documents in relationship to research being proposed. So that is very important to have relevant data. So read the published work, then interpret it, explaining what is the significance or the interpretation of the evidence in each piece of literature, and then synthesize it according to the study that we really want to do. So how do you want to go about synthesizing it? And this is again another original article where we felt AI, there was so much of artificial intelligence, but human in the loop learning was never done. Human intelligence always goes well and well with AI, and we wanted to synthesize human intelligence with artificial intelligence and then perform an original article published in the Indian Journal of Ophthalmology. So the purpose is very, very important, because the right purpose, we have to build on the previous knowledge, never reinvent the wheel, get new ideas, avoid duplication and different ways of performing the research study, and also identify comparative data. And again, as I was telling you about the data or the concept being in your day-to-day practice. So this is one of my patients, an injectable IOL, no financial disclosure, Hoya, which was coming out when I tried to inject because the patient moved his head. So I went ahead, I didn't want to enhance the incision, the 2.2 incision, I chose a different decartridge of alcohol and went ahead injecting it, but the lens developed an optic crack. Even the mistakes can be published so that people won't repeat the same as well. And the peer reviewer gave a comment to me saying that you can actually try enhancing the incision and then placing the same lens. So ironically, and a year or half later, a similar case happened where we learned from our mistakes and from our peer reviewers. So we enhanced the incision and placed the lens through an Alcon C cartridge, as you can see in the red arrow on the left, and that's how it works. So it's all good review, good quality literature search will have many components, which is comprehensive, systemic, unbiased. It should be well written, and it should include up-to-date references. There are many types of literature review. We have the traditional literature review, which is more like a drawing conclusion from a narrative. We have systemic review of literature where we have published and unpublished data. Then we have meta-analysis where we have statistical analysis of multiple studies which are integrated. And then we have meta-analysis or meta-synthesis rather, which is non-statistical, but it has a good pool of data. So we'll have to divide our literature review into 4 and then progress accordingly. So it is very important at every stage, before the study, during the study, even after the completion of study, when we write down the study, we need this. It is divided into literature search, clinical appraisal, and writing the literature. So how do we search the literature? So for want of time, I'm just fast forwarding it. There are primary sources and there are secondary sources. Primary mostly relies on research reports, which are description of studies written by the researchers. Secondary, it is done by the original research is done by not only the investigating researcher, but also by others. We also have a lot of electronic databases now, and the books are there, the conference papers, we have the magazines. Electronic resources are a game changer when it comes today because computer assisted literature, we have Google, Yahoo, PubMed, SkyHub, Cochrane. And if it's a paid one, when I started, if it's locked, I write to the author. If I'm not getting through the author, go to the ResearchGate, try communicating with it, or even ask the pharma company because we may have a tie-up with that particular publisher. Or even if you are an institute, your institute will have access to it. So these are some things that we can use. And this is timeless and boundless where you get so much data. Google platform, Yahoo, PubMed, SkyHub, as I was telling, printed material, even printed material serves as a good data. So 5 steps. We have for the preparation of writing a literature review. One is annotated bibliography, where you need to annotate what is that you need to do. So once you do the annotation, then you go and organize the content. It's all a cognitive mental mapping that you do. It's called a thematic organization, that you organize literature under different themes. As Madan sir was telling, he even organizes his methodology under different subsections. That's a good way to go. And stage 3, more reading. So we need to go and read more because there is more data. Now, once the reading is done, you write individual sections. You can see in this figure, organize it under different individual sections and then integrate all the sections together. That gives you a great detailing. As you can see in one of my papers on minimally invasive glaucoma surgery, there is none of the papers recently in India giving an economical perspective. The first paragraph says where we stand. The second says what is the cost that the patient need to provide per millimeter of IOP reduction, and then the effective cost of intervention, where we can see how is the effective cost of intervention. Then what is the other economical solution like the suture GAT or the bank that you can see here today. And finally, the challenge and the conclusion. So segmenting your article is also very, very important, but integrating the segmentation is the key to conclude it. So the key points: be specific, be selective, avoid abbreviations, focus on source of evidence, and reference management. So this is the other part which I'll take a 2 minutes or so to summarize it. The reference management is again very, very important. We have the Vancouver that we really do, or we also have the other references according to the different editorial boards. You'll have to meet the different references. So let me just forward the other slides. Citing the text, you can see citations are what it is, 1 and 2 that you can see in the text. We have different types of reference and we need to know how to arrange it so that it's very important. The author's name, the title, followed by the journal, the year of publication, the volume, issue, and the page number, where you need to use a semicolon, where you need to use a colon, where you need to use a hyphen between the page numbers, how you need to cite a book if you want to cite a book as the reference. And the internet also can be used. Some give you a ready-made reference in an article like a PDF format. I use Zotira. This is a teaching video, my dear friends. I hope this will be useful for you. I just felt a video will be more useful rather than a theoretical text here. With this, I'll be ending my presentation. So let me have an MIGS study that I'm doing. So I'm creating an MIGS folder in Zotero. So Zotero is an app that you use for your reference manager. Now I go to the Google and type minimally invasive glaucoma surgery, and a lot of article pops up. The article that is more interesting for me, I take it and I go to the right hand side top into the Zotero. I create the place where I have created an MIGS folder. I copy this article and you beautifully have it automatically arranged. Now I'm going into PubMed. My Google search is over. I'm going into PubMed and I'm using different keyword terminologies like a glaucoma surgery or a refractive glaucoma surgery or a micro-invasive or a minimally invasive glaucoma surgery, whatever you want to type, and I get 10 more articles. Now, the more references, the more we need to not have the references jumbled as and when we add or delete the paragraph. I choose all the 10. You can see me choosing all the 10 PubMed articles that I am going to take the content from, and you can see all the 10 are now added here, along with the one initially that I took from the Google. So once all the 11 are added, so let us see what we are doing. Now I'm going to the internet iWiki. iWiki is just an internet site. It's not an article. It's not, it's a peer reviewed, but it's not a PubMed indexed article or anything. It's an American Academy online site. Even an online reference can be taken. You can see the HTTP also being got into the Zotero. So whatever you want, you can take it from Google, PubMed, or from iWiki, or whichever is comfortable with. So now you are seeing me typing just for sake. MIGS is the future of glaucoma, and I just want to give reference 1 and 2. I'm going to take 2 articles. So I'm choosing Vancouver in Zotero, and the 2 articles that I took this line from, or I want to give the reference to the author. This is me going and selecting those 2 studies from the 11 studies that I've taken and kept into Zotero, Arif et al. And the other one from iWiki becomes 1 and 2. Now the second line gets added. So you can see that becomes reference 1 and 2. So now my second line gets added, and that becomes the reference 3. So now comes the tricky part. So now, for example, I want to add one more reference. So this is reference 3 now, the second line. Now the tricky part is if I want to add another reference on top to reference 3 has to become 4. Manually, in the initial stages, I used to change it manually. But now with Zotero and other things, the moment you add a reference, third reference on top of 3, automatically 3 becomes 4. I'm just showing that once again. You can see in this 1, 2, and 3. Now I'm going and adding another reference on top. Once they add that on top, you can see reference 3 comes, and reference 3, which was previously 3, automatically becomes 4. You can see Muller M, which was previously 3, automatically becomes 4. That, my dear friends, is very important when you write a review article which has more than 50, 60, or even 80 references, where you can't be keeping on changing, having a printout, or then marking this is a line I've deleted, and every references gets jumbled. So this is again the last part of the video where how do you can also with the DOI number, also you can go in and you can also manage your references. You can just click it with your DOI number also, you can get the Vancouver style or whichever style that you want. You can see here, every style is there. If you want to go for a different journal and they have a different referral, A to Z, American Society or the Modern Language, you can see Nature, you can see Vancouver, superscript, bracket only, year and date, and so many references just comes as it is. So summary is search for relevant literature, evaluate the sources, identify themes, debates and gaps, outline the structure. With e-computer today, I think we have limitless help and we can easily do it. So provide references in the correct style with accurate bibliography. The editor has full right to reject if the references are not correct, or he may send it even back to the editor for correction. So this is my portal here. Keep try again. My IGO portal where I had 49 published, but you can see the rejections. I think we have Biswasar also showed. This is how we all start together. The rejection will always be more than the number of articles we publish. And citable articles are something that we need to really work on. 2022 was very kind enough for me where I had more citations in 2022. So work on that as well. And the publications will keep coming as this is the right time to start, as Shruti ma'am told. Start right, start now. And these are all some of my publications. Even if you innovate, you can keep publishing them. You'll be the first to do it. And even reference management, you'll have to choose more presentations, or because the data are not there, we have to refer more books. So an idea is that which we all need, and we just need to augment idea with the passion, as Biswas was telling. And thank you once again, respected editor, sir, for giving me this opportunity, and the entire TNOA team. Thank you for your patience.
Wonderful, Priscilla. Super.
Thank you, sir.
Very nice. Very proud of you.
Thank you, sir. Thank you, sir. Means a lot, sir.
Thank you, Dr. Prasanna. So basically what Dr. Prasanna mentioned is like till now we saw how to write an article. Literature research is basically how to read an article. That itself is an art actually. We can't read from the first line to the last line. We need to know what to read and how to read an article. And that will actually enhance the way of writing the article also. So for want of time, we'll move on to the next talk by Dr. Niranjan. Niranjan?
Yes, sir. Am I audible, sir?
Yeah. You're audible. You can start sharing.
Is the screen visible, sir?
Yeah, perfect.
Good evening to one and all. So at the outset, I would like to thank the editor of JOSR, Jayanthan sir, for giving me this wonderful opportunity to share the podium with such giants and stalwarts in publishing. So today we're going to have a practical, walkthrough through publication of how to upload a manuscript once it's prepared, according to whatever the speakers have spoken so far. So, right. So just the outline of today's discussion is going to be about understanding the terminologies. What do you need at hand before the process begins of uploading? The steps involved and how to follow it up. So basically, these are the terminologies we should be aware of. Manuscript can be anything, starting from original articles, case reports, case series, photo essays, etc. So the publisher can be anybody, and for us, TJOSR, it is Walters Kluwer, and journals are TJOSR, IJO, etc., depending on what you choose to upload to. So what all to be kept ready before planning and uploading? Basically, the main manuscript file, the first page. Basically, the first page is all the details of the authors who are going to contribute to the particular manuscript. Like sirs had mentioned, images with legends. So the identity should be hidden. It should not be disclosed in the manuscript. And legends with appropriate numbers and appropriate citation in the text, which is very crucial. And lastly, tables with the table numbers and so on. So with all these things ready in hand, as in the right formats. So let's go to the steps of process of uploading. So this is the frontline page of our TJOSR publishing website. So here, what I want you to look at is the two main boxes. So in here, we can log in as an author and further upload our manuscript. So on the left side, what we see is the hyperlinks to different instruction to authors and etc., which is a very important thing we should all look into before we decide on uploading the manuscript. And secondly, the role. So there are 4 options in this drop-down box, and the one we choose is that of the author. So this is in case we have already registered with the publisher as an author. Now, in case we haven't registered so far, so below is the link which says register as an author, which is to be used. And this is the page for registering, where all the details are to be entered in proper. And here we have different IDs like ORCID ID, PubMed ID, etc. So ORCID is another platform which helps us keep a track of all our publications, and it's very crucial before we start that we have an ORCID ID, so that this is most often asked by many of the publishers in order to be able to follow it up or bring everything under one cloud. So that is the importance of ORCID ID, and the other details are to be entered, and then the registration link will be sent to our emails, with which we'll be able to log into the publisher's webpage. And yes, once we get our details and login, this is our all-in-one display of the dashboard. So as you can see here, everything is self-explanatory, starting from the manuscripts in different stages, very beautifully depicted with different colors. So this is exactly the process of how things go. So first we submit, then we have to keep it up and follow up using these particular options available to us. So once we decide to submit a manuscript, as you can see here, the second option, submit new manuscript, is what we have to press, and that will take us to this page where we have to give all the disclaimers regarding our manuscript. So please read all the instructions carefully, because each of them may not be an yes. So that is why I had highlighted in specific to make sure you read each of them before you choose the option, and then go ahead and press the buttons. Next step is uploading our documents, the main step. So before uploading, I kindly request everybody to go through the guidelines for uploading different documents. It is very clearly mentioned under each document what is the specifications, what is the capacity, and what is the file size that is allowed in the web page in order for successful uploading. So many a times what happens, we don't go through this and upload maybe images of very high quality, of very high file size, which may not be accepted by the website because it has specific rules in order to be able to publish it smoothly. So this is one page where we all have to look into before resizing or shaping our manuscript documents. So here, so to make things very simple, we have a drag and drop option in the website where we can just drop the files into this particular box and it gets uploaded as shown here. So with this, we can make sure that our manuscript or the document is uploaded. So the name of the document appears here and the file type is to be chosen depending on what you have uploaded. So if you use the drop-down box, it will show as to what are the types of documents that it requires. Now, most important thing is there are certain documents which you can't get away with. One is the main file. Second is the first page. So before there used to be copyright form, which was also compulsory, but now copyright has been made much more simpler where each individual author receives a mail where they have to agree for the copyright. So that job is simplified. And then legends, yes, legends are basically like what Madan sir had mentioned, the details of the images and the tables that you're uploading, which is to be mentioned here. And lastly, the file order. So file order, usually the first page takes 1 and the manuscript proper takes 2, and the remaining are to be numbered sequentially in order for smooth uploading. So this is the next page where all the details of the manuscript has to be uploaded, including the abstract, the running title, etc. And to make our jobs very simple, the number of characters that are left or that are to be filled are very nicely mentioned right beneath each box so that it helps us to realign or reconsider the number of words in the abstract, the title, etc. So as we enter the title and so on, the number of characters will reduce and it'll let us know how many we can still add before we reach the limits. Now here we have word count, etc. Now for this, I wanted to make a small tip here is that in most of us use Microsoft Word as the most common platform where there's an option under the review tab which shows about word count. Now this gives a very detailed in-depth analysis of the number of words, number of characters, with spaces, without spaces. So the authors can make use of this in order to be able to enter and fill up these boxes. And last but not the least, like Madan sir had mentioned, the keywords, they are going to help the other authors or the other people who are researching and doing literature review identify our manuscript. So it is very important to make sure you choose the right keywords for your manuscript. And next comes the author's part. Now here, very important, many people have a lot of doubt about the corresponding author and so on. So here what is most important is, first, by default, the person who's uploading the manuscript becomes one of the authors. And he or she is expected to go on adding the other authors using the red box option I'm shown here, the add co-author box. So there you have to enter the details of the authors and go ahead and add them. And they all often can be reordered based on the priority of the person who's uploading the manuscript. So here, once all the authors are added, the display shows the order with the number of authors in proper. So this is the final page where once everything is uploaded and ready for submission. So here is the option of previewing your manuscript, which shows the entire manuscript along with all the images in one PDF. And in fact, as a reviewer, once I did become one, is when I realized that this is exactly what the reviewer gets to see. So make sure that everything is in one PDF and properly arranged so that the reviewer can go through the whole thing easily and go ahead and approve your manuscript. Last but not the least, follow it up. Please understand the different stages of the publication, where you have to understand that initial stages it is under process, goes on to become, the status. Like I mentioned in the dashboard, the status changes based on the process under which the manuscript is. So here in the status tab, please follow it up. And these are often the stages in which your manuscript is found. First under process, then goes on to become peer review. And once the peer review is done, modifications required, the reviewer comments and all are to be read and addressed. Usually, this is often communicated to the author using a mail where your inbox, you'll be getting a mail from the official website saying that the author has made such comments and you are expected to respond to it. Once all of that is sorted out, it goes on to become in production and finally gets published. So please follow up your manuscript at the website on a frequent basis so that you don't miss out on the correct process. And thank you one and all for giving me this opportunity. Thank you, sir.
Thank you, Dr. Niranjan. That was very crisp. It was perfectly said. So this will be available in the YouTube, and this will serve as a guide for the authors, the new authors who are actually going to submit the manuscript. Thank you. And I would like to request Dr. Atik to sum up and with a few words from our President, Ramakrishnan sir.
Thank you, Jayantan, for organizing this wonderful webinar. Listening to each speaker was great, and the purpose of this webinar is all of us or all of you listening to this webinar should become JB sirs in future. So a great initiative done, and this is just the part 1. Our editor Jayantan will be coming up with the part 2 session. The date for the session also will be announced soon. So looking forward to the second session also, Jayantan.
Really, as pointed out, it's a wonderful webinar. All the speakers, they have done a wonderful job. All the keynote speaker, Dr. Biswas, and it's from the beginning how we struggled to publish one paper. Needed time. Now, so there's all the persistence and perseverance, hard work, and also, of course, the speakers, Suriti and Madaloka Bal, Dr. Niranjan, and of course, Prasanna. It's wonderful tips that we have learned so much today. Even though I have done a number of publications, the practical aspect, how to publish a paper in a systematic, scientific way, that is very, very important. How to go for a Hello, it's audible.
Yes, sir. Now it's audible, sir.
Oh, okay. Yeah, how to go about the literature search and how to write the article and where to publish, and all these things are so very important, especially for the younger generation, especially postgraduates, because nowadays, both in service as well as non-service, is very, very important, as mentioned by earlier speaker. I once again, and also I have to thank the panelists, Dr. Sri Devi from Annamalai University, and Dr. Sukas, and from SRMC, and Dr. Kanmani, and also Jayantan and Atik. So really, it's a wonderful session, Atik, Jayantan. Thank you very much. Now over to you, Atik, for what's happening.
Jayantan?
We'll get a concluding remarks from Nirmal sir.
Yeah, thank you, Jayantan. So I just joined to congratulate all of you for the wonderful work done, starting from Jayantan, Atik, and all the 4 speakers. Really great job. And as usual, it's always inspiring to listen to JB sir, his journey. Every time we listen to his story and the remarkable progress he made over his career. So it was so nice to listen to his lecture all the time. And of course, all the speakers have covered every aspect right from start to writing original article, case report, and of course, tips to upload your manuscript. Indeed, we went through some difficulties during our submission, because I can see how Waterproof has also evolved from 2017, ever since we started. Now I think they are in the third version, and a lot of changes that has also simplified the process for the young researchers and publishers. Again, they are also working on simplifying the other aspect of publishing. And Prasanna's talk was really nice because technology is really helping now. So previously when we started, we had to go through the manual books, and most of them it would not be available in library. So few editions would be available. The volume we are searching for will not be there in the library. So that's a problem with physical books. But now technology and blockchain coming up with it's just with one click you are able to get all the resources. So that's actually it's a little spoon feeding for the young researchers. I'm sure they will utilize this opportunity and come up with very creative and useful publications that will really change the way mankind works and how we treat our patients. So thank you so much. A wonderful team effort. Well done. We look forward to the second edition as well. I hope Jayantan will announce it soon. Thank you.
Thank you, sir. Dr. Atik, you can give the vote of thanks. Thank you.
Heartfelt thanks to Ramakrishnan sir, our president, for always being supportive for all the events that is done. Thanks to our vice president, President-elect Nirmal sir, and Arul sir for always being with us and supporting us. This journal TNOA actually went leaps and bounds after Nirmal sir's era and Sharmila madam taking it to next level. Hopefully, Jayantan will take it to really next level. Heartfelt thanks to all our panelists. Proud to say that I'm Suhas sir, student from SRMC. Thank you so much, sir, for joining us. Thank you, Sri Devi madam. Thank you, Kanmani sir, for sparing your time, and all the wonderful speakers today. Thank you, Shruti, Madan, Prasanna, and Niranjan for the wonderful talks. Eagerly looking forward for the next session as well. And heartfelt thanks to Neurotech.
Yeah.
Yes, sir, Madan. Heartfelt thanks to Oro Lab and Team Neurotech for this wonderful webinar. Thank you so much, Jayantan, for organizing this session in such a short time. Thank you.
Thank you.
Thank you. We'll log
Thank
off.
you, sir.
Thank you. Thank you.
Thank you.
Thank you, ma'am.
Thank you, sir. Thank you.